Welcome to the recorded version of Isolation and Loneliness, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Homestead Senior Care.
All right, our presenter today is Lakeland Hogan. Lakeland is a gerontologist and caregiver advocate for Homestead Senior Care. Lakeland works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska-Omaha, where she is studying social gerontology. She has a Master of Arts in Social Gerontology and a Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. And with that, I would like to turn the floor over to Lakeland Hogan. Welcome, Lakeland.
Thank you so much, Steve. Hello, everyone. Thank you so much for joining us today. I cannot believe we're halfway through the year already and halfway through this Caregiver Support webinar series for 2019. But again, just want to thank you so much for joining me. This month, we're talking about a topic that really has gotten a lot of press lately. I don't know if you've noticed, but I feel like isolation and loneliness have been in the headlines. There's been a lot of talk about research that shows the significant health implications of isolation and loneliness. Some studies say that it's worse than that of diabetes, alcoholism, and even smoking 15 cigarettes a day. So again, this is such an important issue because it impacts older adults especially. We know that older adults are at a higher risk of isolation and loneliness. And so I'm really glad that you're here as professionals today to learn more about this topic because it will take all of us to educate the family and caregivers that we work with on this topic and educate the older adults that we work with to hopefully help identify isolation and loneliness in the older adults that we serve, and most importantly, find ways to help reduce the risk of isolation and loneliness, and also how we can prevent it. So again, thank you so much for joining me, and I'm going to start by just briefly going over our objectives here on the next slide. It is my hope that by the end of today's webinar, you'll be able to describe the difference between isolation and loneliness. The two terms are often used together, but there is a difference between the two. I also hope that you'll be able to describe the impacts that isolation and loneliness can have on older adults, and also be able to identify warning signs and identify if an older adult's health is at risk due to isolation or loneliness. And then finally, as always, I'm going to share resources and support information for you to share with the older adults that you work with and to share with family caregivers. So let's go ahead and get started by talking about the definition of isolation and the definition of loneliness. So again, I just mentioned these two terms are often used together, but they do have slightly different meanings. And when we look at these two terms, one is objective, that's isolation, and then one is subjective, which is loneliness. So social isolation arises in situations where a person does not have enough contact or interaction with others. So this is more of a measurable something that's more measurable. We know, one older adult might have social contact X number of times a week versus another, or has X number of social contacts versus another person who has more. So again, isolation is somewhat more objective, more measurable. Loneliness, on the other hand, is more subjective. It's an experience of distress over not having enough social relationships or not enough contact with people. So it really is up to the individual and their kind of perception of their isolation, their social interaction. So again, these concepts can be related, but a person really can be both socially isolated and feel lonely, which seems to make a lot of sense. If you don't have a lot of social connections, you're at a higher risk for loneliness. But a person might be isolated. They might not have a lot of face-to-face contact, but they might not feel lonely, whereas an individual who might have a large social network, they might not be isolated from others in their social network, but they still might feel lonely. So a good example of this is, somebody who maybe lives in a senior living community. They're surrounded by people all the time. But if they haven't made meaningful social connections, they could still feel lonely. So I hope that kind of helps you differentiate between the two terms. And then sometimes depression is mistaken for loneliness, and we know that depression is not a normal part of aging, and we don't want that to go untreated. So I do want to make sure that we realize that depression, while a lot of times somebody who is lonely might also experience depression, it's not one and the same, and a lot of times depression is treatable. So we need to make sure if the older adult is depressed that they get to their medical professional for further assistance and treatment. And then when we look at loneliness and isolation, there's two types of loneliness. We know that there's emotional and social. So emotional loneliness is felt when we miss the companionship of another person. Oftentimes for older adults, this is missing a spouse, a sibling, a dear friend. And then social loneliness is experienced when we really lack that wider social network or group of friends. And as adults age, oftentimes they're losing people in their social network, and we'll talk more about that. So they might be more likely to experience that social loneliness. But we also know that loneliness can really be transient, a feeling that comes and goes, and it can also be situational. So for example, an older adult might feel content most of the time, but on certain occasions, maybe on Sundays when they used to have a family dinner, but it no longer happens, or on holidays when their spouse they and their spouse had a special tradition, but that spouse is no longer there. They might have, situational experiences of loneliness on those certain occasions. But we also know that loneliness can be chronic, meaning that someone could feel lonely most or all of the time. So again, this really comes down to the person and that objective, subjective feelings of isolation and loneliness. And so as I'll talk about later on in the presentation, we really do need to take an individualized approach to older adults when it comes to the topic of isolation and loneliness. But I think when we talk about this topic, it's interesting to see the statistics and the prevalence of the disease, or of this experience, pardon me. So we do know in a report by the Kaiser Family Foundation, they found that overall, they looked at U.S. adults in general, so this is not necessarily specific to older adults, but 22% of adults in the U.S. say that they often or always feel lonely. They feel that they lack companionship, they feel left out, they feel isolated from others. A lot of the articles that I've been reading on this topic that pertain to kind of more of the overall population, they credit some of this to social media and the craze of feeling left out because they see people on social media living a certain lifestyle or doing activities that they're not included in. So that could be one contributing factor. And 1 in 20 people say that their loneliness is a major problem for them. These are among those who are most likely to report being lonely or socially isolated because they have few confidants, or they have maybe a mental health condition or a debilitating chronic illness or disability. People that responded to this particular survey also were more likely to be isolated or lonely if they were of lower income, if they were single, divorced, widowed, or separated. So, and another interesting statistic is that according to a Cigna report, half of Americans report feeling sometimes or always alone, which is a very significant portion of those that were surveyed in that Cigna report. But then when we kind of narrowed down and looked just at the older adult population, a study found that 43% of seniors feel lonely on a regular basis. So we know that this is a very prevalent issue for older adults and for the greater adult population here in the United States. And there really are certain factors that put older adults specifically at a higher risk of isolation and loneliness. So I'm going to go over some of those risk factors in the coming slides. And there are multiple categories of potential risk factors, so I've kind of broken them down, and hopefully it makes it a little more digestible. But the first category of risk factors really center around demographics. So first, living alone. We know that many older adults, they prefer to age in place at home, but if they have lost a spouse or if they've never married, oftentimes if they live at home, they're likely to live alone. We know that home can conjure up all sorts of good feelings such as safety, love, warmth, good memories, feelings of family. So there are a lot of benefits to aging in place at home. But we also know that living alone at home or living alone in general can put an older adult at risk of loneliness or isolation. So it's just something to be cognizant of. Marital status can also be a factor. I just mentioned, those who were unmarried, widowed, divorced, separated, they were more likely to be isolated or lonely. And today we are seeing higher divorce rates or people who have chosen not to marry. And so we're seeing an increased risk factor for individuals who have marital status in those specific categories. We also know that those who do not participate regularly in social groups are at a higher risk. And this kind of seems like a no-brainer. We talked a lot about already how the social connection can reduce isolation and loneliness. So if an older adult is not connected to things like a senior center or a faith community, or they're not engaging in some sort of regular get-together with friends, a book club, a Bible study, those types of things, they might be at higher risk of isolation and loneliness. And those with fewer friends are at a risk for isolation and loneliness. But studies do show that it really is the quality of the friendship or relationship that makes the biggest impact, not necessarily the quantity. So, one true good friend or best friend definitely is more impactful than a handful of acquaintances or people who the individual can't necessarily confide in or feel comfortable sharing and spending a lot of time with. So again, that's having fewer friends is a potential risk factor. And so is strained relationships. We know that family dynamics are complicated in many families due to a variety of factors. So family strain might be experienced between older adults and their children, between siblings, and these strains could date back, decades. And we know that one particular group of older adults is especially impacted by strained relationships, and that's the LGBTQ population. Many of them perhaps have lost contact with family, or they may not have as large of a social network. So we do need to be aware of that as a potential risk factor. And then finally, a person's location can make an impact on their isolation or loneliness. Those in a rural setting or maybe unsafe or inaccessible neighborhood or community, they might find it more challenging to keep up with regular social connections, or they might have less resources available to them. And their location might also be impacted by socioeconomic status. And that really should be another bullet there under the demographics category, because socioeconomic status could put an older adult at risk of isolation or loneliness. The next group of risk factors relate to the individual's health and well-being. So having poor health or well-being can put an older adult at risk for isolation and loneliness, especially mobility issues. So individuals who have mobility issues may not be able to get out and about as often or as easily, which puts them at risk for isolation and loneliness. And mobility issues might also cause an older adult to have to give up an activity or give up a regular social interaction that they've once loved going to or really looked forward to. So if mobility issues are of concern, families need to sit down with the older adult, or we as professionals need to look into, alternate forms of transportation, or are there mobility devices that could make it possible for them to get out and about to those important social engagements, or can they be brought to the home in one way or another? Cognitive impairment, we also know, can be a potential risk factor. This can be isolating for some due to the fact that those with cognitive impairment might experience difficulties with communication. They may not be able to communicate effectively. They might not be able to drive themselves or perform their activities of daily living, which could, create barriers for social engagement. And we also know that those with cognitive impairment oftentimes have a family caregiver that is assisting them, or a family member or care partner that's assisting them, and that caregiver themselves can become isolated due to having to provide around-the-clock care. We see this especially for family caregivers of loved ones who have more of an advanced Alzheimer's or dementia, where their loved one cannot be left alone at all. They have to have around-the-clock supervision. So I know we've been talking about isolation and loneliness in older adults, but we also need to be aware that their family caregivers, those that are caring for the older adults, they themselves might be experiencing isolation and loneliness. And so I'll talk a little bit more about that later. And then poor mental health, or having a mental health condition such as depression could be linked with isolation and loneliness, as I mentioned earlier. And these mental health issues are not part of normal aging. And therefore, again, an older adult really should seek treatment for those mental health issues, as they could be, again, putting them at an increased risk for isolation and loneliness. And then we have communication barriers. These communication barriers, again, can be linked as a risk factor. So when we look at the first one, untreated hearing loss, if you cannot hear, it might be difficult to interact socially. And my grandma is kind of a classic example of this. She has poor hearing and wears hearing aids, but I've started to notice at family gatherings, especially at Christmas, we have a big family, so we have a long dining room table that's set up and everyone's laughing and sharing stories. And over the last couple of years, Grandma will sometimes not participate, at least not like she used to. And I started to catch on to the fact that it really was her hearing loss that was preventing her from engaging in conversation. So our family has definitely more aware of this, and we try to ask directly questions of her, or make sure that everyone kind of quiets down while other people are talking, so that Grandma can still engage in the conversation. Because she has so many great stories and memories to share, we don't want her to miss out on these important social interactions. So it's those loud, crowded areas that could make hearing and socially engaging more difficult. And again, this is a common issue among older adults that could be easily treated with hearing aids. And in some cases, a cochlear implant might be an option, but we know also that hearing loss has been mistaken for dementia or cognitive impairment in older adults. And it can even lead to cognitive impairment if hearing loss goes untreated for an extended period of time. Again, untreated hearing loss can be something that's easily treatable for an older adult to be able to engage socially and hopefully help to reduce the risk of social isolation or loneliness. And then we look at communication barriers. Language barriers could also put an older adult at risk of isolation and loneliness. I know in my local community, we are very fortunate to have an intercultural senior center. And this senior center really is geared towards immigrant older adults and refugees who are older adults living in our community. And they speak multiple languages, and they're very inclusive. So, that type of an environment, if it's available in the community that the older adult lives in, if there's some sort of language barrier, it really could make a significant impact. Or if you can look into, cultural groups within the community to see if they have regular get-togethers that the older adult could attend, again, to prevent the risk or reduce the risk of that language barrier. And then there are also some major life changes that can occur that can put an older adult at risk of isolation or loneliness. The first is leaving the workforce. You know, this is a big life change, going from working probably since you were 15 or 16 and you've been working all your life, and now you're retiring at 65, 70 years old. And, you know, this is definitely a happy time, a joyous time for celebration, because that's been a lot of years of hard work. But if you stop to think about it, the workplace for many is a source of daily social interactions. And after a person retires, all of a sudden those daily social interactions might not be available to them anymore. So it's important that as a person is thinking about retirement, making that transition, that social outlets still remain a priority, and that the individual finds ways maybe to keep in touch with those old coworkers on a regular basis, or joining new clubs, getting involved in volunteering, something of that sort, to help keep them engaged socially. Another major life change, one that seems pretty obvious when it comes to this topic, is the loss of someone that we love or dearly care about. So that could be a spouse, family member, or friend. And this loss could be due to the death or passing of the individual. It could also be due to divorce or the person of importance moving away. The loss of these meaningful relationships, again, could put them at a higher risk. And the ones that are the types of loss I've talked about are considered involuntary losses, but some older adults do detach from certain relationships voluntarily. Sometimes this voluntary loss is referred to as pruning of friendships. As older adults consider, you know, who is important to them in their social networks, they might start to lose touch with some of the people in their social network that maybe were more so acquaintances, that sort of thing. So we do have those voluntary losses, but more frequently it's those involuntary losses that really put an older adult at higher risk of isolation or loneliness. And I mentioned this a little bit, I think I mentioned this earlier, but those who are, yes, I did, the caregiver topic. So those who are caregivers, if you think about it, an older adult, if there's a spouse couple, the wife might become a caregiver for her husband. And as I mentioned earlier, being a caregiver can also put you at risk of isolation or loneliness. So especially for those that are providing around-the-clock care or extended 20-plus hours, extended hours of care for their aging loved ones. So it's really important for caregivers to get involved in things like support groups, or making sure that they're still getting that regular social interaction while they're caring for their loved one. And a lot of times caregivers, especially, again, I'll reference the caregivers who are caring for a loved one with Alzheimer's or dementia, they're at an even higher risk, especially if their loved one needs around-the-clock supervision or cannot get out and about, or the family caregiver might avoid taking their loved one out and about because of the challenges of the disease or the fear of their loved one acting outside of normal social or social norms, you know, out in public. They would rather just stay in instead of go out and about because it just might be too much of a challenge. So that's where those family caregivers need to reach out to their social circles for that sense of emotional support, but also so that they can get a break from that caregiving situation and get out and continue to socialize. And then moving is another kind of major life change that could put an older adult at risk. And it could be moving from the older adult's place of residence, their home, into a senior living community, or it could be making a move from one city to another to be closer to family. I see that happening a lot. But in these types of moves, social interaction with old neighbors and friends might fall by the wayside, and that could really increase the risk of isolation and loneliness. So again, these major life changes are a lot of times probably not thought of in terms of being associated with isolation and loneliness, but something we certainly need to be aware of. Then there are societal barriers that might increase a person's risk. So it could be lack of opportunities to engage or contribute. We know that having a sense of purpose and meaning can really make a big impact on an older adult's mental health and well-being. So that's where volunteer work, especially post-retirement, can be so meaningful and a great source of social interaction for older adults if it's available to the older adult as an option for social engagement. We also know that prejudice or discrimination might be a factor that causes isolation in certain situations. Also, a lack of access to resources, services, again, could create isolation for those that are especially those are living at or below the poverty line. So again, just some things to be mindful of, things to kind of have at the top of our awareness when we're talking with older adults and their family members about isolation and loneliness. But there are, so these have all been risk factors. There are some additional risks in terms of an older adult's health and well-being that we need to consider as it relates to isolation and loneliness. The medical literature supports the overall linkage between loneliness in older adults and declining health. So multiple research studies cite poor health outcomes, including a 29% increased risk of heart disease for those who are lonely, a 32% increased risk for stroke. There's also an increased risk of developing dementia. And actually, one study found that wounds heal slower in those who are isolated or lonely. So I thought that was very interesting. The way that our body heals itself is impacted by isolation and loneliness. And individuals are also likely to have greater perceived stress and depression if they are isolated or lonely, and they also are likely to have poor sleep or their sleep quality might suffer for those who are isolated or lonely. And then there's a final area of risk that is important to consider, and that revolves around mortality. So for some, isolation and loneliness is a life or death issue. One study found that mortality risk increases at about 26% for those who feel lonely, 29% for those who feel isolated, and 32% for those who live alone. So again, isolation and loneliness is not something to be taken lightly. It is something that is impacting the older adult population. Again, there are ways that hopefully we can reduce the risk, especially reduce the risk of mortality for older adults, and we're going to talk about that in just a bit. But there are some additional impacts of isolation and loneliness. Loneliness again, can impact the health and wellness of older adults and can also accelerate the aging process. There is a really interesting report that IBM put out called Loneliness and the Aging Population. In this report, it quotes several experts and really talks about the loneliness kind of epidemic, if you will. But one of the quotes, or I have a couple quotes that I've pulled that I'm going to share with you on this slide and the next slide. The first one is a quote from a well-known expert on loneliness. It's actually John I'm probably going to mispronounce his last name. I apologize. Capio. He worked in the field of neuroscience. He's unfortunately passed away recently, but he worked at the University of Chicago, and he wrote a book along with William Patrick, and in their book it states this about loneliness. Chronic feelings of isolation can drive a cascade of psychological events that can actually accelerate the aging process. So in all the research that John has done through the University of Chicago, he really found that loneliness, that feeling of isolation, can really impact the aging process. And if you think about that, if loneliness and isolation accelerates the aging process, man, that makes this that much more of an important topic and one we need to communicate to families and their aging loved ones. And another quote is by Dr. Vivek Murthy, and he was the 19th Surgeon General of the United States, and he said, during his years caring for patients, the most common pathology that he saw was not heart disease or diabetes, it was loneliness. I thought that that was also a very impactful quote from someone who saw a lot of patients. It wasn't heart disease or diabetes, it was loneliness. So again, isolation and loneliness can really be at the root of a person's health and well-being, and ultimately can impact how they age. So again, just makes the case for why this is such an important topic. And then it also has an economic impact. And we know that for some older adults that are lonely, they might schedule a medical visit when it's not necessarily an immediate need, and it really is just to socialize, to have some sort of social interaction. And over the years, I've worked with many healthcare professionals that have kind of fondly referred to these individuals as frequent flyers in their healthcare clinics or in the ER. Again, it's really the need to socialize. That's why they're making that visit to the healthcare professional. And when you add up all of the financial implications, a recent study estimated that the total financial cost as it relates to isolation and loneliness is $6.7 billion spent by Medicare. So the way they kind of found that number is that they categorized people into kind of individuals that were lonely versus individuals who had more of a regular social connection. They found those that were lonely had an additional spending of about $1,600 annually, more so than those who were socially connected. So again, that's a large dollar amount that's impacting our country economically as it relates to loneliness and isolation. So we definitely, again, need to be aware of this and hopefully prevent isolation and loneliness or reduce the risk for the seniors we serve. The quote on the screen is again from that IBM report, and it comes from George Crooks. He's actually the medical director or was for the UK National Health System, and he said, people will somaticize or convert anxiety into physical symptoms, which is their ticket to get in to see the family doctor. They don't actually have an underlying physical problem. They just want that social contact. So many of you listening, you're probably working within the healthcare field. You might be able to kind of think, oh yeah, we have one or two patients that seem to come in and just want to really socialize. And if we can help them find social outlets or contacts outside of healthcare professionals, then hopefully that can help eliminate those unnecessary visits and that unnecessary healthcare spending that relates to loneliness and isolation. So in all the information that we've covered up until this point, it's very clear that there is a problem as it relates to isolation and loneliness. And that IBM report kind of captured it nicely in this graphic here. It shows that there are many factors that really contribute to this problem of isolation and loneliness in our society. The problem centers around the various obstacles and the lack of effective solutions. So obstacles include things such as lack of standard screening practices for isolation and loneliness, comorbidities that cause difficulties in the detection of isolation and loneliness. So trying to figure out, okay, is it depression or is it loneliness? Having those comorbidities, again, can help or make it difficult to detect isolation and loneliness. And there's also a stigma that seems to surround isolation and loneliness, and it really can prevent people from reaching out to get the help and assistance that they need. And then the lack of effective solutions stems from an incomplete and ineffective stakeholder ecosystem, a disconnect among solution points, and an inaccurate assumption about technology's impact on isolation and loneliness. So again, this is a really interesting report, and if you want to download it and read it for yourself, I would highly encourage it. You can just go to IBM's website, ibm.com, and then you can search for loneliness and the aging population, and that report will pull up there. It's the easiest way to get to it. So now that we've identified the problem and learned about the risks, it's also really important for us to understand the symptoms of loneliness and isolation, and most importantly, how to effectively communicate that to the family caregivers that we work with and to the older adults that we work with. So hopefully, by knowing the symptoms, it can help us all better identify isolation and loneliness in the aging adults that we encounter. So the first category of symptoms are more physical in nature. So isolation and loneliness can manifest in things like aches and pains, headaches, illnesses, or worsening of medical conditions. It can also manifest in mental health conditions. So there's an increased risk of depression, anxiety, paranoia, or panic attacks that could be symptoms of isolation and loneliness. Some additional symptoms relate more so to a person's energy level. Those who are isolated or lonely might have symptoms such as, low energy, tiredness, lack of motivation, or kind of a brain fog, as some describe it. And some might also have issues with sleep, difficulties getting to sleep, waking up frequently throughout the night, issues with staying asleep, or perhaps they're sleeping too much, sleeping throughout the day. Maybe it could be due to the fact that they are lonely. They don't have that social interaction to look forward to. There are a few more symptoms here on this next slide. First is dietary problems. A loss of appetite or a sudden weight gain or loss could be a symptom of isolation or loneliness. I know many older adults, if they're living alone at home, they don't have anyone to share mealtime with. So they would rather just make something unhealthy, or they might not eat enough calories during the day because they just don't have anyone to sit down and share a meal with. So even something simple as sharing a meal with an older adult can increase social isolation or decrease social isolation in an older adult, or decrease loneliness. So if family members are noticing issues in that category, it might be a sign that isolation or loneliness is the cause of that symptom. Also, substance use and increased consumption of alcohol, smoking, medication, or other drugs could be a sign or symptom of isolation or loneliness. And also negative feelings of worthlessness, hopelessness, thoughts of suicide. I talked earlier about how important having a sense of purpose and meaning is. And a lot of times social interactions, especially for older adults who have grandchildren, that provides a lot of meaning and purpose to their lives. And so, again, if families are noticing these types of symptoms, it's time to have a conversation, time to figure out what is going on. And then there's just some additional warning signs here on this next slide. And the first is loss of interest in socializing. So I know we've been talking about how social connections are so important for reducing the risk of isolation and loneliness, but sometimes we see older adults expressing a loss of interest in socializing. And, this could be due to something such as depression, again, which is treatable, or it could be due to things like cognitive issues. And again, this is something that an older adult might be exhibiting as a symptom, and family caregivers need to really get to the root of the cause, the underlying issue, because again, it could be treatable, or perhaps an alternate socialization option could be explored to still keep that older adult engaged, but maybe in a different way. Hearing and vision issues, I've already talked about hearing loss as being a risk factor, but vision can also impact a person's ability to get out and socialize. So it's really important that families keep an eye out for hearing and vision and also have them checked annually for their loved ones. And we've already talked about mobility issues impacting a person's ability to engage and socialize. So older adults might be limited in their mobility, and family members should keep an eye out for when that starts to impact their social engagements with others. And then changes in appearance. Family members see their loved one who was always dressed to the nines, and all of a sudden they're really not dressing up anymore, or their personal hygiene is changed significantly, or maybe they aren't showering or bathing as regularly. This might be a sign of an underlying issue. Again, it could be depression. It could be a sign that there's a cognitive issue at hand that is preventing them from taking care of these needs on their own. And so it's something certainly to be explored. And then transportation issues are something that could, again, contribute to a person's risk of isolation and loneliness. So if a family is talking with their loved one about driving, it's really important that if the older adult has to give up driving, that there is an alternate plan put into place. And this could be community services. It could be family members helping them get to and from their social engagements, really putting together a plan of how to get that individual to their social engagement or activities is really important. And for some, driving difficulties, such as driving at night or in severe weather could be something that could be a warning sign that I know, again, referencing my grandma and our family's experience, in winter months it gets dark at 5 p.m. And so she has a bridge group that she goes to once a month, and they meet it in the evening time. And during those winter months when it's dark earlier, she asks for family to help get her to and from that because she just doesn't quite feel safe driving at night. So again, these transportation issues could potentially impact social engagement. So again, something to be aware of. And then environmental clues, spoiled food in the refrigerator, an unkept house, missed medications, they could all again be pointing to an underlying issue that could be impacting their ability to engage socially. Again, if there's spoiled food in the refrigerator, perhaps they don't enjoy cooking for one. Especially I see this in cases where a spouse recently passed away and all of a sudden there's no one to eat with. And so you'll come over and stock the fridge with food, and you'll come back a week later and half of that food is still there because they don't have that companionship at mealtime. And so it is impacting their sense of loneliness, and could be a clue that maybe some companionship at mealtime would go a long way. Or they don't want to have people over to their house anymore because they're not able to keep up with the house, keep up with the laundry or the housekeeping like they used to, and they're really embarrassed of their living environment. So they've stopped having friends over, and that's causing them to feel isolated. So again, family members sometimes have to put on a detective's hat, or we as professionals have to put on our detective's hat to really find that underlying issue. What has changed? Has there been a significant loss? Has there been a change in the health of the individual that could be contributing to their feelings of isolation and loneliness? And we talked earlier on that slide about the problem, and one of the underlying problems of this kind of overall societal issue of isolation and loneliness is there's really no standard screening process in place. So I did want to share a few assessment tools that are out there. Now, the first one is a quick assessment that could be done by clinicians, healthcare professionals, or could be done by family members. And it's really more of just a conversation, asking questions. How often are you feeling that you lack companionship? How often are you feeling left out? How often are you feeling isolated from others? Those are good conversation starters that can really open up a discussion with the older adult to see, are there certain times of the day, month, or year where they're feeling more isolated or lonely? Or are there areas of their life that's lacking social interaction that they would like to find solutions for? And then another tool, there's this great website called connecttoaffect.org. There's a whole kind of group of organizations that support this website, the main one being the AARP Foundation. And there's an online assessment tool that you can do for yourself to find out if you are isolated or lonely, or you can take the assessment on behalf of a loved one, friend, or family member to see if they might be at risk for social isolation. And there's all sorts of great resources on there. So I would encourage you to visit connecttoaffect.org to find that online assessment. And then there's one more quickly that I wanted to share. The N4A, or the National kind of Area Agency on Aging, they have a great brochure on isolation and loneliness that's really geared towards the older adult. And as part of that brochure, there is this self-assessment checklist. And I think the great thing about this is it's simple, it's easy to kind of score it. As you go through the questions, you just circle yes or no. And then at the end, if you have 2 or more circled in the left-hand column, then you might be at risk of isolation or loneliness. And then if you score 3 or more, according to this assessment, you might already be experiencing isolation or loneliness. And so the brochure also gives some suggestions on how you can increase your social interaction and engagement and reduce isolation and loneliness. So again, this comes from the N4A website. I have the website on the screen here in the bottom left corner, and on this site, it'll list all of their brochures, so you just want to look for the Expanding Your Circles, Prevent Isolation and Loneliness as You Age brochure. But again, this is a great assessment that can be really helpful. So, once you've assessed whether or not an older adult is at risk for isolation or loneliness, or maybe they already are isolated or lonely, then we want to definitely reduce the risk. So reducing the risk of isolation and loneliness will really look different from one person to another. There's no one-size-fits-all approach, but having regular social connections can reduce mortality by up to 50%, studies have shown. So there are ways that we can reduce the risk, so it's important that we communicate this to the older adults that we work with. So the first is to support and maintain those existing relationships. It's far easier to support and maintain a relationship that we already have as opposed to building new ones. So we really need to encourage that and help older adults find ways to support those existing relationships. We can also encourage them to build new relationships. If they've recently moved to a senior living facility, that's a great time to engage in new relationships. Or perhaps you hire a home care company and you develop a relationship with the professional caregiver that's coming to the home. And sometimes psychological approaches are needed to help change thinking about relationships, and that can take place in a therapy or counseling type of environment where we can help the older adult kind of reframe what social relationships are at this point in their life and how to build meaningful and impactful social relationships. And as I mentioned earlier, it really does depend on the person, so it really is important to take that individualized approach. So we need to make sure that we're really understanding where the older adult is lacking social engagement and what kinds of connections will be most impactful for that individual. Some may find a lot of meaning in volunteer work, while others might find more meaning in engaging with family members. So it's important also to focus on that quality over quantity. I talked about that earlier. The quality of the relationship is definitely important, more so than, how many friends do they have, how many connections do they have. So having at least one person in which the older adult can confide in or have a meaningful connection with really goes a long way. And there is a risk of a mismatch of supports, just because again, one person finds a meaningful connection from, let's say, social media or FaceTiming their family members or friends. That does not mean it's going to work for everyone. So we do have to be mindful that that mismatch of supports could do at times more harm than good. So again, that's why it's so important to take an individualized approach. So there are some action steps that we can recommend to families. So first, it's important to recognize that isolation and loneliness is an issue and really understand what may be causing it and then to respond. The worst thing a family member could do is ignore the issue of isolation and loneliness, because we've seen in the statistics and the risk factors that I've presented over this last hour that isolation and loneliness can really be detrimental to the overall health and well-being of an older adult. So then the family should share their concern with their loved one. Talk openly and honest, but at the same time be mindful of the approach and the tone that is taken in this type of conversation. It's really important that the person, the older adult, does not feel attacked, but they feel included in the discussion and included in the solutions and the problem solving around this issue. And if the family discovers that an underlying issue is related to something health-wise, such as hearing loss or depression, they need to get their older adult loved one in for a medical checkup or to see their healthcare professional. It's also important for families to understand what community resources exist in our local city or town that could help provide more social interaction. The local area agencies on aging is a great resource for information on things such as local senior centers or companionship type programs, transportation resources, and so much more. Meals on Wheels programs. So reach out to them for support and resources in your local community. And then finally, get together with the older adult and create a plan. Create a calendar of events. Take time to understand what social engagements are most important to them, whether it's a weekly social engagement, something that happens monthly. Maybe it's just seasonal. Maybe in the summer they like to do certain social activities, or maybe it's something annually like a holiday. Really get to know what's important to them, and then again, work together with them to create kind of a calendar. Gives them something to look forward to. Provides that purpose and meaning that I've talked about so far, and how and just that meaning and purpose again is just so important in contributing to the well-being of an older adult. And as families are putting together their plan, we can suggest some ways that they can connect. Maybe it's through regular calls or visits. Look into transportation options. Maybe it's public transportation in larger cities, or family members kind of creating a schedule of transportation. Maybe it's neighbors or friends that are helping to chip in, getting that individual to and from wherever they need to go. Or maybe it's a fellow book club goer that pops over before book club and picks up your older adult loved one on their way. There are solutions out there, so it's important to find those options. And even, rideshare options are out there like Uber or Lyft that can transport an older adult to an activity. You could try technology or social media. Now, I do want to preface that with the fact that social connection through technology cannot replace, that human, in-person, face-to-face socialization, but it can enhance our social connections. At home, instead, we've recently engaged in a piece of technology called GrandPad that connects people. So it's an easy-to-use tablet. So, introducing technology, if the older adult is open to it, can help them feel more connected. We can also encourage older adults to take a class in something new, a hobby. Maybe help them meet new people who have similar interests that can form new relationships. This is especially helpful for older adults who are still active, can get out of the house and connect in new ways. And then some additional ways to connect, revisit hobbies with others who share the same hobby, especially those living in senior living communities. Many of the older adults that I've worked with over the years that live in those types of facilities, there are groups that get together and quilt. There are groups that get together and play cards or talk about fishing or reflect on being veterans. So there are groups out there. So seek those out. Also volunteering, I've mentioned that already. Visiting a senior center or community wellness program. I know many YMCAs have a Silver Sneakers group. My grandparents belong to that, and they find a lot of enjoyment in the social connections and the physical activity that they get out of those weekly programs. And then also senior centers. Local area agencies on aging have senior centers where there's activities, opportunities to engage socially, and so forth. And then inquire about faith-based organizational engagements. I know many churches and synagogues have groups geared towards older adults, so look into that. And in some situations, a pet might be a good way to provide some regular companionship and give the older adult a sense of purpose. It could be a dog or a cat, or it could be a goldfish or a plant even to take care of that provides some meaningful engagement in their everyday lives. So again, you have to consider all of the aspects of pet ownership, but for some it could be a good option. So those are some ways to connect. And I think something that when we talk about isolation and loneliness, intergenerational connections can be a really great way to provide social engagement for older adults. And actually, our organization recently created this social movement with a goal to inspire people to care and to socially engage with the older adults in their communities. So I did just want to show you this quick. The website is imreadytocare.com. It's totally free to join. The program is called Ready to Care. So you just enter your information, and each week you get a text message with a reminder or an inspiration to care for someone or reach out to someone locally. So the one on the screen, the care mission that week, that's what they're called, is to just write a note to an older adult in your life. So this can be great for, grandchildren or adult children, people of all ages, to get that weekly reminder to just reach out and connect with an older adult in your life. Again, think about how nice it would be to receive a note for absolutely no reason at all. What kind of neat social connection would that provide to an older adult in your family or in your community? So again, it's imreadytocare.com. You can enter your information and get those weekly reminders. And then I have finally some resources to share that connect to Affect website. The UK is really kind of forward-thinking when it comes to loneliness. They have a campaign to end loneliness website with a lot of great resources that you can check out. For volunteer opportunities, the National and Community Service Organization is great. Your National Council on Aging has great information. And then I mentioned earlier, your local area agency on aging. You can find that at n4a.org. You can type in the zip code. Also look for Meals on Wheels programs. And if you do feel like companionship provided by a professional home care company would be a benefit, you can also check out homeinstead.com. So I apologize, I only left a few minutes for questions. There's just so much great information to cover on this topic, and I want to thank you all for tuning in today, and now I'll open it up for a couple questions, Steve, when you're ready.
Okay, great. Thank you very much, Lakeland. Let's get right to the questions here. Okay, first question for you. Are people who somaticize usually aware they are doing so? In other words, are they aware they are looking for an excuse to see the doctor just to see someone?
That's a good question. I think it might be situational. I don't have a solid answer for that, but I would imagine, some might realize that they're doing it while some might not. I mentioned earlier how a warning sign of isolation and loneliness, it really can manifest in things such as headaches or aches and pains. So they might physically be feeling the feelings of isolation or loneliness. And so, in those cases, it might be that they don't realize that, isolation and loneliness is causing them to seek out those medical appointments. So that's a great question. I wish I had a more definitive answer, but I would imagine that for some, they are aware that they're doing it, but for many, it's just that isolation and loneliness has had such an impact that it's affecting their health and well-being. And of course, when anything's affecting our health and well-being, our healthcare professionals are the first place that we usually turn. So I think that's why it makes it that much more important for organizations to, healthcare organizations to find a way to, kind of assess or evaluate isolation and loneliness in their patient population. But that's a great question.
Okay, thank you. Next question, do you have any tips on how you can help a client that is reluctant to change?
Yeah, that's a great question. It's common to find that older adults, they don't want to make changes. And when it comes to isolation and loneliness, that makes it that much more hard because as we age, we're more likely to lose those in our social networks because of their passing or moving, or as I mentioned earlier, the various reasons why we'd have some loss in our lives. So I think that it's important to, again, get to the root of, what's important to them. Is there a hobby that they enjoy? Is there a cause that they support? And find ways to try to engage them in those types of communities locally. Or it might be that, just really working to strengthen those social connections that they already have in place. Working with the existing family members to see if there's a way to strengthen their connection. Maybe that's a good time. I know technology for somebody who's reluctant to change might be challenging to implement, but it could be, again, a way to strengthen those relationships that already exist as opposed to having to go seek out new relationships for those that might be a little reluctant to change. So those are a couple tips. I'll flip back quickly to this resource slide. I check out some of these resources. There's so much good information out there on this topic, and so I would encourage you to check out these sites for more information. But thank you for your question.
Okay. Well, Lakeland, we have reached the end of our hour here, and unfortunately we're out of time, but I want to thank you for a great presentation today on a very important topic. Thanks so much.
Thank you. Have a great day, everyone.